You're about to have a CT scan, and it's a CT scan of the heart, and I want to take a picture of the heart. To do that, I need your help. Before you have the procedure, you'll also be asked to go over whether you've got any particular reactions or allergies that might be important in the scan. And there'll be a full questionnaire given to you and asked prior to the procedure. So it depends a little bit on what we hear from the patient. There'll be a few questions to ask. It's not complicated. We rarely don't do the scan. We'll have to put a little drip in there, a little plastic drip in the arm, usually in the elbow if we can, sometimes on the back of the hand. And that's done before the procedure and before you go into the room. And we use that so that we can give the dye, or is known as contrast, during the course of the scanner. We sometimes have to put a little bit of beta blocker, which is an intravenous drug, which slows the heart rate down and takes a bit of the adrenaline that we all pump, takes the edge off that as it goes around the body. So when you actually get invited into the room, first thing to remember is try to stay relaxed. It's very straightforward, it's not a difficult test. You're not going to have to do anything very complicated. And the more relaxed you are, the better your heart rate and the better the picture. So remember that as your top priority. The second thing is, as soon as you're lying on the bed, we'll almost certainly connect you up to an ECG monitor using our 4 stickers. And once we've done that, we'll check what your heart rate's doing. If you're relaxed and your heart rate is nice and relaxed, we can go straight ahead. Now, before we start, I need to give you a little spray under the tongue of something called GTN spray, which opens up the arteries and we get a slightly better view of what's going on. Just to warn you, you may get a minor headache, but it wears off very quickly. The crucial thing about this test is holding your breath. Kind of, apart from relaxing, it's the most important thing we do. And the reason for that is your heart is tucked underneath your ribs and we have to take a picture over a few seconds. When we take that picture over about 5 seconds, we don't want the whole chest to move, because if the whole chest is moving, unfortunately the heart underneath moves with it. You'll be lying on your back, so some people like to imagine they've got a drink or a cup of water sitting on their chest, and when they hold it still, they imagine it doesn't move as they keep things nice and still. If your chest is still, your heart is therefore still, and we get nice pictures. What I'd like you to do is try and hold your breath for about 5 seconds, 3 times, on 3 separate occasions, about a minute apart, so you've got plenty of time to recover. And what you'll hear is breathe in, breathe out, breathe in and hold it, and then I want you to hold your breath for 5 seconds, and then breathe away. And you're going to do that 3 times with about a minute gap in between the 3 scans. Sometimes we do 4 scans, but usually 3. The first scan is always a setup scan, and that's a very quick scan. The second and third scan usually involve a small amount of contrast. And as far as you're concerned, you'll just get a slight hot sensation. So that's the dye or the contrast that goes in through the drip. On the second of the scans, it's a very tiny dose, and you'll get a tiny, you may get nothing at all, you may get a very slight hot sensation. But after the third scan, the final scan, which is the most important scan, at the end of the scan, just as we've finished, you'll start to get this flush sensation going through the body, like having a quite impressive hot flush. And it makes you feel like you want to go to the loo, or you've even been to the loo. It gives you funny hot sensations and sometimes a funny taste in the mouth. It's very quick. It almost goes as quickly as it comes, but it's a bit unexpected if you're not aware of it. So we just warn people, it's not a problem, it's not particularly nasty, it's just a weird sensation for a few seconds, that's all. So in terms of how long you might be in the scanner, once you get in the scanner, providing your heart rate is fine and we don't have to give you a little bit of beta blocker, it's a very quick scan. Once the scanning starts, it's about 3 minutes. It's incredibly quick. There's a little bit of setting up while we connect you up to the ECG leads, and we usually allow about 15 to 20 minutes for each patient. And that involves getting the patient on, reassuring them, connecting them up, doing the test and getting them off. So the actual test, the actual scanning is very short. And once you've had the scan, it's very quick afterwards. You can hang around for 5 to 10 minutes. We usually recommend that. Make sure you're happy. We take the drip out, make sure there's no bleeding from where the drip went in, and then we can send you on your way. The most patients that we scan, actually, they don't have heart disease, and it's a good test for saying that you haven't got heart disease, and we can reassure you. If you have, and we find a bit of narrowing in the arteries, then we can then go on and do other tests as appropriate. But it's a good test for sorting out people who've got chest pain that we can't quite work out what's going on. Occasionally we get referred for other reasons, including people who are a bit short of breath and other reasons, but that's the main reason why we get to see people.